We'll return to amendment number 2, offered by the senator from the Cape and the Islands, Mr. Cyr, the title of which the clerk will read.
Amendment number 2 by Mr. Cyr, health care as a right.
Question comes on adoption of the redrafted amendment. The senator from the Cape and the Islands, Mr. Cyr.
Thank you, Mr. President, and through you to the members. The get what you pay for market-based healthcare model that we're spending a lot of time tonight talking about and trying to fix has some pretty big challenges to it. Massachusetts currently spends more on healthcare than any other state in the nation. In 2016, we spent $59 billion statewide. Of that quite hefty astronomical number, $17.2 billion was spent on mass health, $16.6 billion on Medicare, and $3.5 billion on public insurance options like Commonwealth Care. That's a heck of a lot of taxpayer money for health care. Premiums have steadily increased over recent years, 12% in the last 5, without a corresponding increase in access or quality of care. Middle-income households who earn too much to qualify for assistance but are struggling to make ends meet bear a very high burden of this health care spending. Premiums and cost sharing for families for family coverage are amounting to up to 30% of average household income, nearly $20,000. Small business owners who try to do what's right by their employees and by their families are left burdened by exorbitant health care costs. I've watched this play out in my own family. My parents started a business in the mid-'80s. The cost of providing health insurance to a few of their employees in my family just went up and up and up and up and up. And now that the amount that they pay for their health insurance is over 30% of their income. Our sick care system leaves much to be desired. The current model often requires little consideration for the needs of patients receiving at-home care and their caregivers, leaving patients to navigate a labyrinth of forms and regulations while they're at the most sickest and most vulnerable in their lives. Our system has also made very little progress on health disparities, particularly in minority communities, which continue to suffer an unacceptable lack of access to affordable and high-quality care. Many of us, and even more of our constituents, subscribe to the principle that health care is a right for all people. But the current sick care system has neglected many, and worse, we're stuck with the highest cost in the world. I have to ask, is there a better way forward on this? And can we wait? Can we afford to wait to not address this? So this amendment, Mr. President, that I have sponsored with the help of the gentleman from the Middlesex and Worcester district would require the Commonwealth to assess the potential performance and impact of a single-payer healthcare system. So how would that work? The Commonwealth, under this amendment, would collect data through the Center for Health Information and Analysis, CHIA, in order to develop a single-payer benchmark, or basically the projected total cost of providing health care to all Commonwealth residents. CHIA and the Health Policy Commission, as well as the Division of Insurance, would be responsible for submitting a report on the performance of the single-payer benchmark as compared to actual state spending on health care. If, according to state analysis, and those analytics, the benchmark is determined to have outperformed actual spending, then the Health Policy Commission would be charged with submitting a single-payer healthcare implementation plan to the legislature for consideration. This amendment keeps all doors open and, in my opinion, is just common sense. All of you have heard from constituents on health care. Hundreds have written to me, have called my office, and many have stopped me on the street and have asked, can't there be a better way at this? And we can't wait for us to fix this. But I also admit anyone who claims that a transition to a single-payer system would be easy or swift simply doesn't get health care. When I try to get my head around health care policy, and all of us have been doing a lot of that over today and yesterday's debate, I like to think of, you know those balls of rubber bands that you get at Staples? that basically are rubber bands layered on rubber bands on rubber bands. So if you break that open, right, you see how interconnected everything is, how interlayered everything is. And I really realize it's a good analogy for our healthcare system. And so that it's really impossible for us to make one move or one sort of dramatic move without complicating or likely harming the rest of that web. And so that we've got to really think thoughtfully and carefully and deliberately about how do we unwind this this ball, this net, and that requires an extensive roadmap. This amendment empowers the state's healthcare experts to extensively and impartially study the potential benefits and drawbacks of a single-payer system, and then, if the cost savings are worth it, develop a roadmap to get us there. Importantly, and especially to those of you in the chamber who are skeptics on what a single-payer system would do, this amendment would not commit the state to switch at any point in the future. Simply, it keeps our options open, which is the responsible thing to do, especially with a healthcare system that is such in turmoil and so dysfunctional across the country and at the federal level. So I really believe that it is irresponsible for us not to look at an alternative, that that not taking this up is not listening to our constituents who time and again are asking, is there a better way? And that moreover, that this is an alternative that every other developed nation has been able to rely on in some way. And, you know, look, I'm all about Commonwealth Massachusetts and American exceptionalism, but I think sometimes you got to take a look at neighbors and peers for best options. In fact, this bill that we're taking up today is actually all about that. So this amendment would provide us, I believe, with the knowledge and the data to allow us to begin to untangle the mess of this sick care system and put us on a road to more affordable, accessible, and efficient health care. We cannot wait. So I ask, Mr. President, and through you to the members, that you support this amendment. Would really like to thank a number of colleagues who've worked on this, particularly the gentleman from Worcester and Middlesex counties. And I really ask that members take this up so that we can ensure that health care remains a right for all residents in the Commonwealth, that we continue to lead the nation on health care, not simply in theory but in practice. And Mr. President, I ask when this matter be taken up, it be taken up by a call of the yeas and nays.
Gentleman asks when a vote on the matter be taken by a call of the yeas and nays. Those joining with them rise and be counted. A sufficient number having arisen when the vote is taken will be taken.